Hello, my name is Carlos Jimenez. I'm a senior manager with Wipfli LLP. Thank you for your interest in the Rural Health Clinic program. You have accessed part 2 of the 4-part session entitled Medicare Cost Reporting for Rural Health Clinics. This session is designed for individuals who are not familiar with Medicare cost reporting for RHCs. For additional information about this topic, please access Part 4 of the Medicare Cost Reporting for RHCs, as well as other focused educational rural health clinic webinars sponsored by the Wisconsin Office of Rural Health. So let's begin Medicare Cost Reporting for Rural Health Clinics Part 2, RHC Costs Defined. Before you, you see the very basic formula for how an RHC cost per visit is calculated. You have the numerator as allowable RHC costs, the denominator RHC encounters or visits. Now, it is important to note that the calculation above is based on total cost and total encounters for the entire facility. So it is an average cost per visit for all different types of patients. We will revisit this formula in the next part of this session. What are allowable RHC costs? Well, those are defined at 42 CFR 413 subparts A and G through G. These are downloadable through the internet, and you would just search the 42 CFR 413, and you can access any part of these regulations. Detailed explanations about the types of expenses that are allowed or not allowed are furnished in the Provider Reimbursement Manual, that is CMS Publication 15.1, and that manual is generic to all types of Medicare allowable and non-allowable expenses. So those are readily available, as I said, online. Now, from within the Medicare Benefit Policy Manual, you see the citation there at the bottom of the screen. Section 70.1 gives us the following definition. Allowable costs must be reasonable and necessary and may include practitioner compensation, and that can be salaries or contract fees, overhead, equipment, space, supplies, personnel, and those are personnel who participate in the operation of the clinic other than practitioners, and other costs incident to the delivery of RHC services. Now, that is a somewhat broad definition. We'll define it a little bit more as we go forward. What are some source documents for allowable RHC costs, or we should say RHC costs that then we make a determination as to their allowability? Well, the first is your general ledger and trial balance. And it is important that the accounting system identify expenses by departmental or functional groupings. Otherwise, it is difficult for program auditors or the preparer of the cost report to determine where expenses should be grouped on the cost report forms, and we'll see those a little bit later on. Second source are financial statements, and it should go without saying, but worth mentioning, that those financial statements, there should be a tie out to the general ledger and trial balance between those source documents and the financial statements. If you represent an independent or freestanding RHC, those financial statements would generally be prepared by an outside accountant or accounting firm. If you are provider-based, that is affiliated with a hospital, it would be prepared internally and audited by an outside accountant or outside accounting firm. The third point is very, very critical when it comes to supporting cost and their allowability for Medicare purposes and for your Medicaid programs. Maintain supporting documentation for all journal entries, purchases and payments, and all payroll transactions. And that is readily available If upon audit or review, you are required to provide the documentation for any amount reported on the cost report. So I have a couple of forms here just to show you. The first is the independent or freestanding RHC. It's CMS form 22292, and it is Worksheet A, which is essentially the cost report trial balance. So we'll take a quick look at that. And here it is on your screen. Don't get swayed by all the columns and lines. It's a fairly straightforward. We're going to read from the left of the screen, the left of the form. And you see here, at least on this page, that there are various categories in which we are required to report costs, expenses, on the cost report. So the first is facility healthcare staff costs. And you see there the types of employees or contractors that are required to fit in that section. You have your practitioners, your physician assistant, nurse practitioner, may have visiting nurse, other nurse. You see the categories there. Across the page, we are required to report compensation, and generally that is construed to be any type of compensation, be payroll or contracted fees, and then other expenses totaling in column 3. Within the cost report, you are permitted to reclassify expenses that perhaps are reported in one area and more accurately should be in on a different line number or a different what is called cost center. There are adjustments. There may be expenses that we know to be non-allowable, so those would be eliminated in column 6. There are some other forms where the detailed supporting column 6 is listed. And then the net expenses, which really are the net allowable expenses, appear in column 7. So you see down in the middle of the page, costs under agreement, and those are physician services for physicians who are not employed. We have other healthcare costs, and these are costs directly attributed to the healthcare operation. And then we start at the bottom of the page, the facility overhead, facility cost section, and you see some of the types of expenses that are listed there. Now, before we go to the next page, it is important to familiarize oneself with these categories, because when we take the general ledger, the trial balance, that is the source document for the cost report, the accounts need to be grouped, or there needs to be an ability to verify which of these categories shown there on the left, which of these cost centers the expenses would go into. At the top of this now, the second page, page 2 of Worksheet A, we see the remaining types of facility overhead, and then there is additional facility overhead that is not related to the facility but to administrative costs. You see those in lines 38 through 48, and again, just you can take a look at those at your leisure. Then after line 50, we have the cost other than RHC FQHC services. These are the cost of services perhaps provided in the clinic that Medicare does not consider to be RHC services. Now, it is important to note that some Medicaid programs do allow, in fact, most allow for dental optometry services. We'll talk a little bit about some of the other non-RHC services as we move forward here. You see at the bottom of the page non-reimbursable costs, and those are things that the program, types of things that the program clearly does not allow. So that is the cost report form for a freestanding RHC. If you are provider-based, that is a part of a hospital, you would utilize CMS form 255210. That's the hospital cost report form, and Worksheet you actually would use the Worksheet M series, and the one we're going to look at is Worksheet M1. So this, somewhat similar to the form you just saw. You have the healthcare facility staff costs, costs under agreement, other healthcare costs. There's a few different things listed there. You also have costs other than RHC Services. And then the difference here is that the facility costs and administrative costs actually flow to the rural health clinic from the hospital cost report. So the facility costs and administrative costs that get posted here are actually the allocated overhead amounts. We won't go into that in any detail, but suffice to say that within the hospital cost report, the rural health clinic is listed as another cost center, which then receives allocations of various types of overhead. Those go down on this particular type of form on rows 29 and 30. What are some common types of non-RHC services and costs? You see them listed there. We have chronic care management, durable medical equipment, any services that practitioners render to hospital patients. That would be visiting hospital inpatients, visiting people in the emergency room, if such in an ambulatory surgery center. Outside laboratory services, and those are laboratory services beyond those mandated by CMS to be provided by the RHC. Medical directorships in and of themselves, just strictly medical directorships, are non-RHC services. Telehealth, outside imaging, the same basic principles as with outside lab, and pharmacy services. So if any of these types of services are performed or purchased under arrangement within an RHC, they are not considered to be RHC services, and in most cases would be considered non-reimbursable or non-allowable. So that is a very basic presentation of the RHC cost, and this is the end of part 2. I want to thank you again for your interest in the Rural Health Clinic program. You've participated in part 2 of the 4-part session entitled Medicare Cost Reporting for Rural Health Clinics. For additional information about this topic, please access part 4 of the Medicare Cost Reporting for RHCs, as well as other focused educational rural health clinic webinars sponsored by the Wisconsin Office of Rural Health.